My name's Maggie Wilson and I work as Head of Children's Commissioning for Ealing Council and for NHS Ealing. It's a dual role. The issue that we were facing here in Ealing was that our domiciliary care providers were all focused on adult services. They weren't geared up specifically to deal with the needs of children with additional needs. So we were putting services into children's homes that were really not child friendly and child focused. So what we wanted to do was to, through a procurement process, identify a range of providers who were geared up to and committed to working with children with additional needs. What we did was to work between the NHS and London Borough of Ealing in order to develop a joint commissioning response. That was facilitated by the fact that we have a joint commissioning team and we have people who are duly accountable, so it was easier here, I think, to do it because we had that structure in place. So we had a joint approach. We also decided fairly early on that we were looking for 3 distinctly different types of domiciliary care response. So we decided to divide our specification into 3 lots or categories of service. One was the more home-based care to help children with personal care needs in their own home. The second was more to do with buddying and enabling children with additional needs to access more mainstream services. And the third was to do with nursing services required by children with really complex healthcare needs to enable them to live at home with their parents and to give their parents a break from the sometimes 24/7 hours a day task of looking after their children. So we had a tender, we have set up a framework, and there are 7 providers on the framework. Some only provide 1 of the types of service, some provide 2 and others provide 3. And we now know who we can go to, and it's enabled us to go through a process of quality testing the providers from a child's perspective. The impact has been beneficial. As I've said already, we've had our 7 providers go through a quality testing process, so we know now the quality of the provision. We're also quite clear about what they can offer so that when we need to put a service in, we can go to the right service provider and we know in advance what the costs will be. So we're much clearer about what our providers can offer. We've also managed to negotiate some good prices, so in terms of value for money and cost efficiencies, the process has enabled us to negotiate effectively with providers. We've also managed, I think, through the process to stimulate the market. So some of the providers are already working with children, some are beginning to develop that as an area of expertise. So we've managed to stimulate the market by getting more providers who are focused on the needs of children. What we've also done is to achieve our ultimate aim, which is to enable children with disabilities or complex health needs to live more effectively with their families in the local community. So, for example, for a child with very complex healthcare needs who otherwise might need to be hospitalised, we now have nursing agencies going in providing home-based care for them. And for children without complex health needs but with severe disabilities, we are, for example, able to provide them with the support that, again, enables them to live at home but also to access mainstream services. So in terms of our ultimate aim, which is enabling children and young people to live at home, to access ordinary services, we've managed to achieve that by deploying 3 types of services to meet their needs.